apologize for the delay, a couple technical difficulties, but we've worked through them, and I know you're a very patient group of people, right? Thank you. First of all, we're very excited to make some announcements this morning, but first, we really want to make sure that we are doing everything we can to prepare for the future, and that involved a conversation I had yesterday with the White House. Jeff Zients has been very engaged with the governors, as well as a separate conversation we had later in the day where we talked about the vaccine rollout, but he gave me some very good news, which was he wanted me to know early on that the border would be open with Canada. Yay. This is good news, particularly for the communities along Western New York, the northern border, who really are so integrated with the Canadian communities. It's neighbors. It's just crossing a bridge, just like we cross a bridge from here to anywhere in the city. It's the same as many of these communities. So I applaud their decision to reopen the border. It'll be coinciding with the opening of the international traffic on flights. I had spoken to him earlier about the timing. I said it would not make sense to have people be able to fly in from Toronto but not be able to drive across the border from Fort Erie to Buffalo. So then they heard from other governors and elected officials on this as well. So that is very, very good news. It's something I've raised since I took office August 24th. And so that's good. We also have to make sure our pediatricians are preparing for the opportunity to administer the vaccine to children. This is going to be a game changer for us. There is so much anxiety among parents right now, as we saw increases, more so in other parts of the country, but certainly in our own state, increases in the number of children getting this virus. And it's a very frightening thing. I'm a parent, and all you are hardwired to do is to protect your kids and make sure they're okay. And this is something that has been a source of anxiety for many. And so we are working very closely with our pediatricians. We're going to have a whole strategy. I'll be doing a Zoom call with pediatricians and all the other individuals involved in the decision to get the vaccine available, make sure it's plentiful for all the pediatricians' offices. One thing I did raise with the White House was that one of the challenges that the way that the vaccines had been distributed before was in large bulk, and that doesn't work for a pediatrician who's going to want to schedule appointments and have their normal normal physicals and well visits with kids. So they are going to be packaging them in smaller batches, which is going to make a lot more sense. So getting them involved, engaging all the different places, including schools. We'll be talking to school districts about the availability of administering the shot for children in schools as well. So we're going to be doing a lot of work now that we have the confirmation that this is inevitable. It's going to happen. It's just a question on timing, but we will be more than prepared here in the state of New York to deal with that. So we're going to be asking pediatricians to enroll in our program. We're going to make sure that they have the supply, and again, I'm going to be working with all of them and anybody who will help us get this out. And some parents will want their kids to get it at the local pharmacy too. That's fine. They'll have plenty of supply as well. So pediatricians, start getting ready. It's coming. It's coming, and it's not a second too soon for us. I also want to mention that there was a disappointing decision yesterday. We are pertaining to our vaccine mandate, which I will stand behind any day of the week. We believe it worked. It has had a dramatic effect on our ability to protect people, particularly healthcare workers. And you've heard me say this over and over. When someone is sick and they go into an urgent care center, they go into a hospital, they are in need of help because they're in a vulnerable physical state. They need to know that the person taking care of them will not pass on this deadly virus to them or their family members. And that has been the whole objective behind this mandate. I've said it's not something we wanted to do. It's something that this pandemic has forced us to do, and with the results we're looking for. So my responsibility has always been to protect the people of this state. I will be standing behind this mandate, and I will make sure that we are taking legal steps. We'll be appealing this in the Second Circuit. We'll be working on those papers right now, working with the Attorney General's office as well. So let's just talk about what people are saying about this. Religious leaders are saying get vaccinated, and here's just some quotes from all the religious leaders. If you want to get if someone needs more confirmation, if they're going to use the religious exemption, and I think the courts ought to pay attention to this too, what the religious leaders are saying is that they want people to get vaccinated. It's simple, and we just want to make sure that people are safe and doing the smartest thing we can, which is getting vaccinated. So I don't need to read all those to you, but that's a broad representation of many of the religious communities represented here in the state of New York. And I want to thank the faith leaders for doing this. They have stepped up. I have heard from all of them that they support what we are doing and they will back us up. So thank you to them as well. We hit a milestone Friday. I was very excited. I was sitting, that would be my Albany office, but we sat there and I saw the numbers pop up. I knew they were coming. I knew they were coming. And when the dashboard hit 85, I was like, yes. 85% of New Yorkers over 18 have had at least one dose of the vaccine, which is quite extraordinary, and I'm really excited about that. And of course, everybody knows me. It's like we don't rest on our laurels even a second. So the next words were, let's hit 90. Let's keep it going, and I believe we can achieve that. The requirements that we've had in the past, a lot of questions before we hit another milestone Friday, which was our deadline for home health care workers and adult care facilities for everyone who works in those facilities to be vaccinated. So what's been the takeaway? Well, I think the numbers speak for themselves. Look where we were August 24th, it's the date you may or may not remember. It's the date I became your governor. And I've been tracking since then what we've been doing with nursing homes. You can see the rate going from 71% to 92%. At least one dose. That's quite extraordinary. That's the active staff. I want to point that those are active staff members. Hospitals, 96, up from 77. I think that the mandates have brought people to the right decision, and you can see that bearing out in what we have right here. And also adult care facilities, we went from 77% up to 95. That's pretty high. And also home health care, we went from 83% to 86 on the day of the mandate, but now the active staff now are at about 94%. So I hear about this a lot from everybody. I was literally walking out of Melba's restaurant in Harlem a couple nights ago and was approached by a woman on the street who says, I had to get my vaccine last night. You made me do it. Yeah, I did. And I said, she says, and it hurt. And I said, I'm really sorry, but you're going to be glad in the long run. And she was very nice, and we just had a nice conversation. She says, okay, I'm okay. I just want to let you know I did it. I did do it. And I said, thank you for doing it. So everybody's been affected, and the people who have, I know for some it was an easy decision. They couldn't wait to get vaccinated. Most of us are in that category. But for those who are more reluctant and had to come to this, for a variety of reasons, I thank them as well. I truly thank them as well. They'll be the reason we get up to 90 before too long. And then the whole purpose is not to have mandates for the sake of mandate. It's to get us through this pandemic. I mean, we are all sick and tired of this. We want to say it's over. And this is the way we get to that point. One issue that has been raised is the staffing issues related to this mandate. And I want to be clear when I'm talking about the numbers. We have numbers that show we are at a 3% total workforce reduction in these categories. I know this has been a question, and that includes hospitals, nursing homes, adult and home care. We also have about 0.5% who are still waiting to get vaccinated, who are in the category, and they have plans to get vaccinated soon. So it's a broad number. It includes people who've been terminated, resignations, people just decided to retire at the time, but also people who are on furlough who are waiting to see the outcome of the litigation. So it is still a fluid number, and we're going to keep, we'll get data when we can, but right now we're at about a 3% workforce reduction as a result of these mandates. But look how many people are vaccinated, and the vast majority of people are on their jobs, despite what we had been told by everyone early on that it's just going to be impossible to implement this. People stepped up when they needed to, and I'm grateful for that. One thing I've recognized as I monitor the numbers coming through, as you do on our various sites, it's just too complicated. You shouldn't have to have a medical degree to figure out what is going on with the state of play with COVID in your own community. So we are launching a new data set hub where you can find all the dashboards and data sets on one place very easily. And we're going to continue giving people a fuller picture and more transparency when it comes to all the data that we have. So you're getting it as soon as we have a clear picture. It's all about improving transparency. We still have some disparity in the regions, as we've been talking about for a while. And so, you know what we're talking about. It's the North Country, it's Mohawk Valley, it's Central New York as well. But some people have said that number is not exactly accurate because some communities may test more than others, so I will take that. So let's give another way of looking at the numbers so we can assess exactly what's going on in different parts of our state. And that would be to look at the per 100,000 average. and statewide you see the numbers reflect the percentages, but this gives you a better idea of exactly how many people based on per 100,000. So what we're going to do in those areas that we've identified as being higher than 4%, we're going to deploy more pop-ups. We're going to have more Vax to School pop-ups. We're going to boost education outreach. And I want you to know we are in regular communication with the local health departments. They know that we are there to help. We are there to supplement and to reinforce the messages. And they've been tremendous partners, again, turning upside down the framework of the past, which was more Albany-driven and Department of Health-driven out of Albany. We are there to help, and we have been helping, but I also want to continue to empower local governments where they have hundreds of employees who literally trained for years to be ready for something like this, and why not liberate them to do what they do best? And so we are in constant communication with them, and that is working out well. As you see, most of the state is in a good place. But also you talk about the numbers, percentage, per 100,000. The real picture is how sick people are getting, and that would be reflected in the daily hospitalizations. And we are continuing to see hospitalizations flatten. As you know me, I'm not spiking a football anytime soon, because we also saw, as I mentioned a dozen times now, what happened with the fall last year. Different scenario, more people are vaccinated, but also I walked the streets. I walked over this morning. I was out walking last night. A lot of people are dining outdoors, and I love when I walk the streets of Manhattan. People are wearing masks outside. I mean, that's why we have such a low infection rate here. It's about 1.3%. But people are going to start being indoors. People in Buffalo, people in Plattsburgh, probably not going to do a lot of outdoor dining in January. So the reality is people are going indoors, and that could have an effect on the infection rate. And Delta is what we're dealing with. Delta may or may not be flattening. I'm not going to say it is, but I like the way that is. At least we're not going upward. I think that's a good, modified good news story. Again, we reached 85%, 85.1. Have to bump up the numbers among young people and remind people to get their second dose if you've already had your first one. It's not fully effective until you get that second dose, and then we get into wanting boosters as well, which I'll talk about in a minute. Breakthrough infections creeping up a little bit, but again, the number that is most important, someone who may have been, people who are vaccinated, who contracted again, tend to be showing lesser symptoms, more like a flu for a day or two, or barely aware of it. I've been with people, found out later, who told me that they didn't show any symptoms at all. So there are asymptomatic cases of having this. You may be fine, but you may have spread it to your mother or your grandmother, and that's what we have to be vigilant about. Hospitalizations, though, we first started tracking this for about 0.05%. That is a good situation right now to know that many people are not succumbing to this and having to be hospitalized. Boosters, all about the boosters. Let's boost the boosters. We sent text messages to over 450,000 people to let them know that it's time to get your booster shot. I, fortunately or unfortunately, am still too young for this, but at some point, and I said this to the White House, I mean, can we just make these more widely available? I mean, everybody who's been vaccinated really wants to make sure that they are fortified heading into the winter season. So I continue to promote the boosters. You can sign up to get it now. Should have gotten your message. If you're vaccinated at a non-state run site, you probably received a reminder from your provider as well. So let's get people boosted for boosters. Okay. Again, I'll just reinforce the classifications that are eligible. It's still 65 and older, underlying health conditions, and people live in high-risk settings, high-risk jobs as well. So no reason not to do this. The lines are not long. It is such a different dynamic from what we dealt with last year when there was such a scarcity of supply and a lot of stress around that. It's not there anymore. We talked about the groups that are eligible. I've given you this before, but if you can reinforce that, that's very helpful to us. And we're tracking now the booster shots that have been administered. Almost 447,000 additional doses have been given. Some of these people were able to get it because they were in vulnerable categories before the time that Pfizer okayed it, which was September 24th, I believe. But this is a cumulative number to show exactly how many people have received a booster. Again, just trying to give you as much clarity, give the public every bit of data as we receive it. Flu season is here. Yeah, how about that? Last year, I don't know, a lot of people got the flu because everybody wore their masks, and that was good. with lesser restrictions. We want to make sure that everybody's protected, that you don't end up getting the flu or COVID or both, which is the worst case scenario. So encourage people to keep wearing your masks, good hand hygiene, and we're going to be starting a PSA. A very exciting announcement is to see this, and then we'll follow with something else that we're going to do. Here's a sneak preview.
Are you ready for flu season? With kids back in school and many people returning to work, we need to prepare for both flu and COVID this fall and winter. Protect yourself, your family, and your community by getting both vaccines. Everyone should get a flu shot. And people 12 and older should get a COVID vaccine too. Talk to your healthcare provider about getting both flu and COVID-19 vaccines. Learn more at health.ny.gov/flu.
So in order to practice what I preach, I'm going to get a flu shot. And he's promised me it would not hurt, right?
We'll do my best.
Thank you for coming over. I appreciate this.
Happy to help you.
I'm going to put my mask on too.
Yep.
My mask back on. My mask up there. Those are close to each other.
Okay, 1, 2, 3.
All right, thank you, Doctor.
All right.
Appreciate that.
Take care.
Thank you. I made sure I wore the mask so you wouldn't see whether I winced or not. I smiled through the whole thing, just so you know. With that, be happy to take your questions, and I think we'll start with Zoom.
Good morning, Governor.
Good morning.
The first question comes from Michael Gormley of Newsday. Michael, your mic is open.
Hello, Governor. Mike Gormley.
Hi, Mike.
You being a spiritual person yourself, can't you see or can you understand the feeling of some people who feel personally that their religious convictions keep them from getting the vaccine? I mean, is there some nexus here that you can understand or help reach these people?
Oh, I completely understand, Michael. I have no doubt that people feel strongly about this, but sometimes you have to do a calculation of what is important, and to the extent that someone's personal beliefs interfere with my ability and the people of the state of New York to be safe and secure, then their beliefs are important and deeply held. But we also have a public health objective, which is overriding, and that's the position we're taking in court.
Thank you.
Thank you very much, Governor. Your next question comes from Nick Reisman of Spectrum News. This will be our final Zoom question. Nick, your mic is open.
Hey there, Governor. Can you hear me?
Yes, I can.
I'm wondering, one, if you have any thoughts on whether there should be a vaccination requirement for children heading into the classroom. And on a separate topic, the Excluded Workers Fund is set to be exhausted by the end of the month. Some advocates and lawmakers are calling for that to be replenished. Is that something that is under consideration?
First, with respect to children, my default position is to trust the parents to do the right thing. As soon as that's available, we'll be monitoring after a few months how effective it has been to ask parents to do something that they certainly did for their children before they even entered kindergarten, that they made sure that they were vaccinated against any disease that could harm them. And I believe that there'll be a strong sentiment of people doing that voluntarily. I am certainly willing to look at this. I know the state of California has said they will mandate that, maybe it's Los Angeles, but for not till next fall. So I want to go by the data, the numbers, and see how effective the approach is just to encourage people and have many pediatricians make it part of a child's checkup or part of their basic routine series of getting their vaccinations. I mean, that's what should be happening. So I will monitor that, but willing to take a step if we see numbers that we're not satisfied with. Also, with respect to excluded worker program, I'm very proud of the fact that we were able to get $2.1 billion out the door, money that had been jammed up all summer for no reason. We launched a whole team of people to solve this problem day one in my administration. The money is out, the money is making a difference, and we're certainly looking to see what's going to happen when the moratorium on evictions is lapsed in a couple more months. We have until January 15th. I'm also going to be working closely with advocates and people in all of our agencies, starting with Department of Labor, to find people jobs. I mean, to help people be able to make those rent payments and find out what barriers are existing to that. I talk to business people every day of the week, and they are so frustrated that they can't find workers they're looking for. So there's a disconnect that I need to help bridge right now, and to help people who are anxious about making the rent payments, how they can be helped in other ways as well. So we're very much in tune with what's going on, but the money would have to come with the legislature, and that doesn't start till January anyhow. So we are trying to work it out through some alternative means.
Governor Hochul, to follow up on that, the Excluded Workers Fund, is there no action you could take now to replenish the fund, which is about to be out of money and leave potentially hundreds of thousands of people without aid who are qualified for that aid? And on a different note, can you confirm that you called Cynthia Nixon yesterday, and can you tell us what you chatted with her about?
Yeah, I saw her on the set when I was at the Hurricane Maria Memorial a couple weeks ago, and I talked to her. I let her know that the state is no longer pursuing the foundation aid lawsuit that occupied many people's time. The AQE alliance that was formed, and Cynthia Nixon was an important part. I called her. I called other leaders. I left a message for Senator Robert Jackson to let him know, and as well as the executive director of that organization. When we're taking steps, I think people should know what we're doing, and it's part of my transparency. So I let her know that her advocacy and championing the cause of making sure that there's quality education for children, particularly in our underserved communities, that legal battle is over, and that we officially have settled the lawsuit. The money was put in the budget last time. We'll make sure the money is there going forward. So that was behind that conversation. It was a nice chat. With respect to the excluded, yes, we are working hard. I'm very conscious of what's going on there. It troubles me greatly that there's so many people still in that state of distress. But the money that we had before, $2.1 billion, was an extraordinary amount of money, and we don't have that level of money available just to deploy for something like this. We've been trying to deal with this crisis. I'm convening more people very shortly to talk about what we can do in the short term, and I'm talking about finding ways to get more people opportunities to have gainful employment as well, to help them make those payments.
Governor, yesterday you met with Assemblymember Ron Kim and some of the advocates for nursing home families, and you gave them something they have been asking for a long time, which is an apology. What exactly did you apologize for? I
apologize for the pain that those poor families had to endure as a result of their family members contracting COVID in nursing homes. And it was a very emotional meeting, and it came about in an unusual way, but I'm a little bit unusual in my approach sometimes. I was walking over. I do a lot of walking. I walked over to the office and literally ran into Ron Kim in the middle of the intersection. And apparently he had just been out front protesting and making some, doing an event in front of the building. And I said, Assemblymember, you don't have to stand out here to get my attention. Come on inside. Let's have a meeting. Let's set it up within a couple weeks and bring these families here who deserve to have someone give them acknowledgement of what they've gone through. And I thank them for what they've done. Some of them said, we just want to be retired from what we've been having to do for the last year and a half, which is to fight for people in nursing homes. So it was very emotional. It's hard to describe what went on, but I work with elected officials. They can disagree with me one day, another day they might agree with me. I just approach this whole thing differently, that people deserve to know that their government listens and actually cares, gives a damn about them.
Governor, I just want to follow up on that question. The families actually made a list of demands to you. Yesterday they thanked you for apologizing, but they also said, we'd like a victims' compensation fund, we'd like a memorial, more transparency. What are your plans? Do you plan to honor those requests?
We actually opened lines of communication where there were none, and that was what they recognized as progress. During the conversation, we talked about the memorial, for example, and we are already working on a memorial down in some location, not the original location, because that was not well received by the neighbors. There will be an opportunity to honor their family members, and they actually offline they talked about the Victims Compensation Fund with my staff. And again, this is something that has to be worked through with the legislature, but they know we're giving them a hearing, but also I've already directed my staff, this is not a one-off. I hold myself accountable. This is not just it wasn't a photo op. We didn't tell the press. I didn't even know if that was going to be, I don't need a press conference to do the right thing. And that's what we did yesterday. We opened the lines of communication, and I felt that they appreciate that, but I'm going to be continuing to talk to my team about how we can take steps forward to do what we can to alleviate their pain.
Directed the Port Authority to hold work on the LaGuardia Air Train. What are you looking for in alternatives to that, and could you elaborate on that? And secondly, there's been intense speculation that former Governor Cuomo might jump into the primary race. I'm wondering, if you were to do so, what you think that means for the Democratic Party in New York if he jumps in?
I have no thoughts on that, absolutely none. I'm the governor of the state of New York, and I expect to continue being the governor of the state of New York. People are receptive to our new brand of leadership, transparency, collaboration, and concepts that they've not seen for a long time, and we don't just talk about it, we do that every single day. So I will not be distracted by who's going to run, who's not going to run. I have too much work to do. Your first question then was on the air train. There were some decision points that need to be made by the Port Authority this week, which is why I gave direction with respect to the lawsuit which is pending. They needed to know some direction on that, as well as whether or not to continue with bids. What I am going to do, and people will learn this about me, I'm going to take a broad approach to this, knowing that we are going to offer the people of the city and people who visit through our airports at LaGuardia, that we'll offer them world-class mass transit opportunities to get from LaGuardia to the city. I'll get that done, but I want to take some breathing room to assess what's been done in the past, what ideas were rejected, and how we ended up with AirTrain in the first place, because I have my own opinions, but I'm going to listen to experts. I know this is a little radical, but I'm going to take the time necessary to get it right. And I feel very confident in that process, working very closely with Rick Cotton and the Port Authority, who also understand my vision. And we have many other projects that we need to fund. The challenge for us is our revenues have plummeted because of the pandemic. So there's a broad vision, plans that were in place, but I also have to say, okay, what can we pay for now? What's going to go over here? What's going to be permanently over here is while I'm searching for an alternative. But I have some other projects that I'm already working on for a very ambitious state of the state that I know you'll all be in tune to. Thank you for coming out today, everybody.
Dr. Hochul, can you just confirm if you